Hello, my name is Dawson Baracani. My topic for the argumentative project in English 391, taught by Raymond Terhorst, is why athletes in the NFL should be allowed to use cannabis. Overview. NFL players have traditionally been prescribed opiate drugs to treat the pain and injuries they experience on the weekly basis of an NFL season. These practices have gone on for decades. These opiate drugs present a major health risk to the athletes as they are addictive and can lead to drug dependency and overdoses. Cannabis offers similar recovery benefits to opioids, but with zero health risks. A high percentage of NFL players currently use cannabis, but risk a fine or suspension in doing so, as the NFL continues to outlaw the use of marijuana through their drug testing programs. The dangers of opiates. An Outside the Lines article written by ESPN explained that 71% of NFL players surveyed in a study reported a misuse of opioids. 15% of surveyed retired NFL players in the same study reported opiate use during the last 30 days. Not to mention, the average time since these players have retired from their NFL careers is 7.5 years. So 15% of these retired NFL players, 7.5 years after they last played in the NFL, have recorded opioid use in the last 30 days. Opioids trigger the release of endorphins, which make us feel good and boost a sense of pleasure. Eventually, our bodies slow their production of endorphins, which leads to addiction and drug dependency. Some more dangers of opioids. According to the CDC, in 2021, 80,411 people died from opioid overdoses. This makes up for 75% of all drug overdoses in 2021, according to the CDC. The NFL claims they prioritize the health of their players, but continue to only allow a dangerous method of recovery. As you can see in one of the pictures I included, nearly 280,000 Americans lost their lives to overdoses involving prescription opioid drugs through 1999 to 2021. So how cannabis compares to opioid drugs? In a study done by Ryman, Welty, and Solomon that collected data from 2,897 medical cannabis patients, respondents reported that cannabis provided relief on par with their other medications, but without the unwanted side effects. In the same study by Ryman, Welty, and Solomon, 97% of respondents said they were able to decrease the amount of opiates when they consume cannabis. So cannabis not only can decrease and eliminate the need for opioid drugs among patients. A single cannabis overdose death has never happened in human history. Obviously, people have died from cannabis, maybe through car accidents or work accidents, but an overdose like through cannabis is almost not humanly possible. The potential of cannabis in the NFL. 81% of respondents in that same study done by Ryman, Welty, and Solomon answered that taking cannabis by itself without other opioids was more effective at treating their pain than taking cannabis with their prescribed opiates. Now, there's very minimal evidence that exists for the actual healing properties while using cannabis, but rather cannabis helps athletes decompress from the stress and helps them forget about their pain or injuries following their games or long practice. My call to action. The NFL needs to strongly reconsider their policy of cannabis usage among their athletes. Allowing NFL players to use cannabis as a treatment method will reduce the opioid use that has continued in the league for decades. As we all know, not only in the NFL, but our country has a very large problem with opioid addiction and overdoses. Reducing opiate usage will save lives and spare players from dealing with dependency issues that have a high probability of continuing after their careers are over, as I stated earlier in the presentation, with the 15% of retired players that have reported using opioids with an average of 7.5 years after their careers have ended. So essentially, I'm not calling for the banning of opioids in the NFL, as some players still may prefer to use them as they don't want to feel the euphoric effects of cannabis, but rather, I'm calling for the permission of athletes to seek recovery through a far safer and organic method like cannabis. Here are my references, and thank you for watching.